Can a one-piece removal offer a fresh start? Spine tumor surgery is not one single operation for everyone. Surgeons first decide what problem surgery needs to solve. There are three main problems surgery can address. First is nerve or spinal cord compression, which causes pain or weakness. Second is loss of spinal stability, meaning the spine cannot support normal load. Third is controlling tumor growth at that spinal level. Surgeons prioritize protecting nerves while limiting unnecessary injury to healthy tissue. Sometimes, limited surgery is enough to meet the goal. This is common when pressure on nerves is causing symptoms. Many tumors respond well to radiation after surgery. Surgery can support other cancer treatments. Less extensive surgery often allows faster recovery. However, limited surgery may not fully control the tumor in some cases. Sometimes, stronger tumor control becomes the priority. This happens when tumors weaken spinal bone. It is also considered when tumors resist radiation. In selected cases, surgeons aim to remove the entire tumor to lower regrowth risk. Removing bone often requires rebuilding spine strength. Removing bone changes how weight is carried and can weaken the spine. Surgeons may use screws and rods to restore support and alignment. Planning depends on anatomy, tumor behavior, and health. Bigger surgeries usually need longer healing and more activity restrictions. The goal is the right surgery for the right situation.